Triage. Every day, millions of people face emergency situations the world over. To ensure that they receive optimum treatment, triage is vital. In ophthalmology, especially with your retina, we have multiple scenarios where delay in availing treatment can result in irreversible vision loss. For improving follow-up for the patients with high-risk retinal conditions, we innovated the E1, E2 emergency coding system. In the course of patient care, we noticed a significant problem. Patients requiring emergency care fail to avail the treatment on time, losing precious vision. Why does this happen? The doctors who are treating the patients have excellent knowledge about the patient's situation, but are they unable to convey the emergent nature? And what about the counselors who schedule the patient's appointments? They lack the depth of knowledge on the diseases and often in a busy OP counsel all patients in a similar fashion. Consequently, the patient does not understand his disease and the need for prompt treatment. Mixed signals are perceived from all the quarters and there is delay in treatment. So, we went out to devise a solution for this problem. Not something complex, but easy and elegant. Born out of this dilemma was the E1, E2 emergency coding system. Various diseases were coded into 3 categories and tabulated with their treatment options. This was made available to all the doctors and counselors. Coaching the counselors on these conditions enabled targeted counseling. The categories E1 included very high-risk cases like endophthalmitis, retinopathy of prematurity, retinal detachment due to giant retinal tears, who had to avail treatment within 1 to 4 days of consultation. E2, which covered a large majority of retinal diseases like proliferative diabetic retinopathy, age-related macular degeneration, retinal vein occlusion, were to avail treatment within 10 days. Category 3, including very few scenarios in which your retina, like SFIL surgeries, could avail treatment at their own convenience. The E1 cases, in addition to targeted counseling, received reminder phone calls on the day prior to their appointment and were followed up. In case of a missed appointment, they were tracked and reminded again. The E2 cases were tracked to check if they had availed treatment and received reminders only in case of missed appointments. As a result, over the course of 3 years, we saw that 80% of the E1 cases reported on the same day and 12% another day following a reminder. Similarly, a total of 96% of E2 cases availed treatment. The system is not without certain burdens imposed on the counselors. Increased counseling time, need to make phone calls, and manual tracking do add to their workload. Currently, we implement the E1, E2 system across all our hospitals and continue to coach our counselors to improve their knowledge and communication. The strategy is also now integrated into our electronic medical record system and involves audio-visual or group counseling in some scenarios. This system can be further strengthened by the fully integrated EMR that sends automated reminders to patients and gives pop-up reminders to counselors. By working as a team, doctors, counselors, and patients can have a positive impact on visual outcomes.